Hi, this is Dr. Rahman, and today I'm talking about health misinformation. It's rampant. And how are we supposed to differentiate what's real and what's not? And ultimately, whose responsibility is it to educate us about our health and our bodies? Let's think about this just for a moment. Recently, I've heard women that are peri and postmenopausal saying they had no understanding about the changes their body was supposed to go through. No one had told them that this was going to happen. And not long ago, Michelle Obama talked about how no doctor had told her about the female biological clock, and she subsequently had to deal with fertility issues, which made me question whose responsibility is it really? Often parents, mothers don't feel comfortable talking to their young girls about puberty and menstruation and sexuality. And we have school systems that all they want to promote is abstinence and no other conversation. So, whose responsibility is it really? Is it the doctor's responsibility? In this healthcare system where a person's given a 10 to 15-minute office visit and insurances prioritize surgical procedures over education, how could it be realistic to expect that your doctor has the opportunity or the inclination to educate you about changes that may or may not be happening to your body? Is it a realistic expectation with our current system? And the reality is that when no one's talking about it, when parents aren't talking about it, when school systems aren't educating our students about reproductive health systems, when doctors aren't doing it, there are these gaps. And that's where the medical misinformation starts to fill in the gaps. And we end up with lots of misinformation. We end up with medical mistrust, and we end up with billion-dollar wellness brands. Is that what we want? And what can we do about it? I guess is really the better question. What can we do about it? Do we Google? Do we go to Chat GPT? Do we find an app? And does that solve the problem? Having an app or going to Chat GPT, because convenience doesn't necessarily equate into care, and none of this is perfect. And so we need to have a better understanding of how we can approach the responsibility that we each have in terms of educating ourselves. It's our responsibility, but we need to draw from the assistance of others and other institutions to help us to formulate a better understanding about healthcare. We need to be able to educate our young girls about puberty and menstruation and sexuality. We need to be able to educate pregnant women about more than this is how much you should gain in terms of weight during pregnancy, we need to be able to educate them in terms of nutrition and epigenetics and how all of these things factor in when they're carrying life. And so I am suggesting that we should all do two things. First, we should take the responsibility of health education as our own, and that we supplement our understanding and we supplement our education by drawing on the expertise and the experience of others. And we use AI and ChatGPT not as a place where we get answers, but a place where we start to formulate an understanding so that we know the questions that we should ask when we go to the healthcare provider. The Surgeon General has recognized that medical misinformation is rampant. Other professional societies like the American College of OBGYN recognizes that misinformation, particularly for women and reproductive health issues, is rampant. We all are dedicated to correcting this problem. But women in general, we should understand that we can't necessarily believe everything that we see online. We don't necessarily need to believe everything that comes from ChatGPT, because particularly for Black women, we may not be well represented. But we need to use these as starting points, and we do need to hold our healthcare professionals accountable for giving us additional information, the expertise, for providing their expertise to help us to partner with them in order to optimize our healthcare.